Hey everyone, Amanda here, and in this video I want to talk about oppositional defiant disorder. I'm going to be reading the criteria from the desk reference to the diagnostic criteria from DSM-5 from the American Psychiatric Association. And recently this has become an actual written down diagnosis for my son, and I know that there are many parents out there that go through this, that have children that have some sort of a conduct type disorder or traits of, and it's not easy being the parent or caregiver of a child or children with, behavior problems like these. But you are not alone. I am right here with you. So please please take comfort in that, okay? Now, this is under disruptive impulse control and conduct disorders on page 219. Oppositional defiant disorder. A pattern of angry, irritable mood, argumentative, defiant behavior, or vindictiveness, lasting at least 6 months, as evidenced by at least 4 symptoms from any of the following categories, and exhibited during interaction with at least one individual who is not a sibling. Angry, irritable mood. Number 1, often loses temper. Number 2, is often touchy or easily annoyed. Number 3, is often angry and resentful. Argumentative defiant behavior. Number 4, often argues with authority figures or, for children and adolescents, with adults. Number 5, often actively defies or refuses to comply with requests from authority figures or with rules. Number 6, often deliberately annoys others. Number 7, often blames others for his or her mistakes or misbehavior. Vindictiveness. Number 8, has been spiteful or vindictive at least twice within the past 6 months. Note, the persistence and frequency of these behaviors should be used to distinguish a behavior that is within normal limits from a behavior that is symptomatic. So, in other words, not all children, or not all people, I should say, have a disorder. Let me rephrase. People might exhibit these behaviors, but that doesn't necessarily mean they have a disorder. Sometimes it's situational, sometimes it's cultural, so that's why you can't just suddenly diagnose someone. You have to get to know the person, see what they're like in their environments, over time, and then eventually make a diagnosis. For children younger than 5 years, the behavior should occur on most days for a period of at least 6 months, unless otherwise noted in criterion A8. For individuals 5 years or older, the behavior should occur at least once per week for at least 6 months, unless otherwise noted in criterion A8. While these frequency criteria provide guidance on a minimal level of frequency to determine symptoms, other factors should also be considered, such as whether the frequency and intensity of the behaviors are outside a range that is normative for the individual's developmental level, gender, and culture. B, the disturbance in behavior is associated with distress in the individual or others in his or her immediate social context. Examples are family, peer group, work colleagues, or it impacts negatively on social, educational, occupational, or other important areas of functioning. C, the behaviors do not occur exclusively during the course of a psychotic, substance use, depressive, or bipolar disorder. Also, the criteria are not met for disruptive mood dysregulation disorder. Specify current severity. So mild symptoms are confined to only one setting, example, at home, at school, at work, with peers. Moderate, some symptoms are present in at least 2 settings. And severe, some symptoms are present in 3 or more settings. Okay. So that is oppositional defiant disorder, defined like that. But again, with all disorders, it's very unique to the individual. Everyone's behavior is different. Even if it's similar, it always has a unique spin. So just because somebody has a bad temper or can be vindictive at times doesn't necessarily mean they have a disorder. Again, it's when it's causing severe impairment in functioning in day-to-day living and relationships and things like that, when it causes huge problems. So again, if you are a parent or caregiver of someone who has been diagnosed with oppositional defiant disorder, or you think they have some sort of behavioral disorder of any kind, you are not alone. I understand. It is scary. It is sad. And it's hard to watch your child fall apart, and there's nothing... Sorry. It's hard to watch your child fall apart and not be able to do anything for your child. And it's hard when you are the recipient of that child's behavior. I don't think there are support groups for that. But anyway, you're not alone. And I hope this was helpful to somebody in any kind of way. Okay, so I will put all that information in the description box. And of course, if you want to have the full, all the information on the full amount, blah, 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 I can't even talk today. If you would like more information on it, you can always look at the big book. It's more in depth. It has more in it. And, just keep loving your kids. Just keep loving them, even if you can't do anything else for them. Okay, so I hope that was helpful. Thank you for watching, and please take care of yourselves. I love you all, and I will see you in my next video. Peace and love, guys. Bye.